Yes? Can you listen
Great.
to me?
Yes. Wonderful.
Perfect.
Let's seize opportunity
Okay,
and let you speak. Go ahead.
Okay. Okay, well, thank you very much for this invitation. I am very pleased participating in this meeting. I can share the preliminary results of our work and research. It's the project for health inequality and access to social security for informal work in Latin America. This is project support for Rockefeller Foundation, and we are working on this the last 3 years. No, I will present 4 points. The first is the informal worker magnitude and trends. This is the very important point for us because one of the weaknesses that we have is we are not necessarily have a good data to try to measurement that what happened for informal worker. And many times when we talk about the mapping solution, we want some intervention that really we want was effective of this. And when to analyze some for the data and also to try to link for the health outcome and universal health coverage, we have a big gap, no? And I would like to comment something about of this in regarding for the Latin America. The second point I would like to explain is about the heterogeneity on the informal worker, no? Not necessarily all the informal worker in the context of the country is the same. We are different kinds of informal worker, different needs about of this. And we need to try to discuss when we talk about the intervention, what is the specific that we need depend for the kind of informal worker and what are the common on all of them, no? The third aspect that we need to try to comment is about the access to health service. We will talk about the informal worker. We have 2 specificity. One is worker. The second is the informality. And what do you mean exactly when we talk analysis, the barrier to access, no? And I would like to comment something. And finally, we have to present the very preliminary result about the mapping, the intervention that we are doing in the region. Well, this is our work, the 3 components that we have. It's that they present. We take some aspect for the different components that we are working, some for the case study, some for the qualitative research, and some information about the core indicator, no? I think in this point, in the last point that I commented before about the core indicator and the data to try to monitor what happened and also know the impact for intervention, we have a lot of gaps, no? For example, when we review the survey in the region, household surveys, health surveys, and also some for the labor surveys, we try to identify what is the mechanism model they use to measurement informality, no? And in a lot of the region, the more frequently used is the Economic Commission, the Latin America, that use the proxy, the size of enterprise, no? And we have only 12 countries that they use the ILO model proposed, no? That we can to try separate the informal sector and informal employment. And this is one of the weaknesses that we have to try to analysis, because sometimes in a lot of the report of the country, they use the CLAC model you use the proxy of them and not necessarily represent that really what happened on each country, no? And when we try to analyze what happened for the information about of health, specific for universal health coverage, we only identify 6 countries in the region that really want to measurement health outcome in regard for informal worker. And not necessarily a lot of the survey for health include informal worker, and we try to use some proxy about of this. And all we have available in country, for example, for
Is this likely to be a long or a short reconnect?
We'll ask her.
Okay.
But the connect.
Okay.
Orielle, can you unmute your microphone?
Okay, now it's fine?
Yes, thank you.
Okay, thank you. Okay, and I comment that we have only 7 countries that we have indicator in the survey for access to health care, and only we have 11 countries with access for health coverage for enrollment, no? And this is the big gaps that we have to try to analyze the data and to try to propose something for the impact, the evaluation, or impact or evaluation about the experience, no intervention. Okay, the first I will present something for the trends, informality in Latin America. This is some of the data for ILO and also something for the ILO WIGO that we have a lot of effort to try to measurement of what happened. And if you know, you have in the last 20 years, we have not changed the magnitude of the informality in the region. And some of the evidence that you say that not necessarily a lot of the effort about of this impact that to change the measurement, the magnitude of the informality, no? I think that when we try and analysis this process, we try to, not necessarily in all the region we have the same context, no? We try to develop in some country taxonomy to try to identify the different group in the region, no? We develop some indicator about informality and some indicator for health system available in this region that we come to try to analysis and development the different group of the country. When to see the region, we have in this taxonomy that we try to analysis about of this, we identify 4 groups, no? The first is more low informal sector size. Is indicator that we use is the proxy because it's the more available in a lot of the region. The high health system coverage. The second group is what are the group that we have medium low informal sector size and medium high healthy system coverage. And the third group that we have it's the group that the medium and high informal sector size and the medium and low health system coverage. And the fourth group is the high informal size and low health system coverage. Did we try to implement this taxonomy because when we analysis the SAM intervention and results of the SAM program policies, we need to try to understand the context of them, no? The context is the structure for the labor market is not the same. The trade open is different in different country. The welfare state, the level of development is different, and maybe the sum for the social protection policies and program is different in the context. When we try to analysis this in the trends of informal employment, next, no, they can see. You can see the next. Okay, when you can see the trend on informal employment in the total not agriculture, you can see the 4 group. I don't know if you can see or not. Yes, okay, perfect. You can see the trends of different groups. It's different. If you see the first group, it's really we have to some decrease for the informal employment. The second group, we have to the same trends in the last 20 years. And if you have the group 3, we have the trends of the group. It's some increase, but not a lot. But if you see the 4 group, you have a lot of increase in the last time. And when we try to analysis some of the evaluation for the intervention of them and some for the policy or program, we need to clarify the different context of the country that we have, no? And for us, this is useful to try to analyze what happened inside of the region and also when to try to analyze between the different regions, no? The second point that we like to try to comment is about the heterogeneity of informal worker, no? If we try to analyze the content of the country, if we try to analyze the content of the country, also we need to try to analyze what happened inside of the country, no? Inside of the country, we have the different reality about the informal worker. Some of them is when to analyze the heterogeneity of the informal worker, we have the different aspects. I don't know that we move the next. Okay, the next, please. Okay, when we talk about in the heterogeneity of informal worker, we have to some sociodemographic variables very different, no? When we try analysis Colombia, this is 3 examples. This is the different country and different group that present before. If you see, we have informal worker, we have through the different level income, and you know the more proportion of them is relation for the low income, and also we have in another level of income. At the same time, we have the male, female, but more frequent is female insect for this informal worker. At the same time, we have the different age group, no? And this is important because sometimes we are thinking to try some intervention, address the informal work anymore younger people, and we are thinking in something for technology is very different. We are thinking about the more older group in search for the informal work. And this is part that when we define some intervention, we need to try to analyze, no? The next, please. In this way, when we, okay, in the next, because to present all of them. Okay, thank you. When we analyze the challenges for heterogeneity, I think for us is the two aspects is crucial, no? Something for this is employment relations, and at the same time the level of protection, the labor and social right, no? In regarding of this, when we analysis for the different kind of the informal worker, we have the different situation, no? Some of them we have the really more material resource and power for to try to negotiate for the government on another level of the state for to try to access for the health system, but another we have the more vulnerable, more weakness for to try to do of this. In this way, we try to develop some model for to try to move or understand the barrier to access for health system, and we try to use some of our research before for to try development of this way. And we present two aspects, barrier associated to employment condition, and the second barrier associated to organization of the health system, no? The next, please. And the next. Okay, and when we analyze the access to health service domain, very frequently, yes, we analyze the course, the what happened for the phase involved for access for health system, no? We have the healthcare need, perception of need, and desire to care, healthcare thinking, healthcare vision, continual healthcare. And this is the similar that we analyze more frequently. But when we analyze perspective for informal worker, I think that we have blocks different kind of barrier. One blocks more relation for associated employment condition, and another more barrier associated to the organization for the health system. Please, and when to analyze this, the next please. No, before, so sorry. Okay. No, before. Okay, well, when we analyze this for the informal, yeah, great, thank you. When we analyze this for the both block, when we're talking about more for the barrier associated for employment condition, is we try to identify what is the specificity when we talk about the informal worker. It's not only for the poor people, we talk about that really that we have another group, not necessarily poor, in the level to follow poor or not necessarily poor, but at the same time we have the specificity about informal employment and at the same time for the worker. And in this way, we identify something for economic deprivation, perception of vulnerability, temporary unemployment, work and disempowerment, and lack of right that we need to comment. And another way, we have the more traditional way when analysis the barrier linked for organization of health system. We talk about the available, the accessibility, acceptability, contact, and effective coverage that I commented before, no? And we have two aspects crucial, the financial protection, no, it's before, no? It's move, you are move before. Yeah, well, you have two aspects. The financial protection for us is crucial, and the second aspect is the labor protection. When we talk about universal health coverage for informal workers, we are thinking also financial protection, but for us it's also crucial when we talk about the labor protection. And when we analyze more for the barrier associated to employment condition, we identify these 5 domains, and we have some examples. The next, please. The lost income during the healthcare for, I don't know, that before. So sorry, yeah, I come to see sometime the slide very well here. Okay, well, economic deprivation that we have some examples for loss of income during the healthcare attention on medical rest. I think it's important that some of them, the salary day is very important for to try to family and themselves. Perception of vulnerability also is the crucial for to try to understand what is the healthcare need and perception of need and desire for care for this worker. Sometimes the temporal employment is crucial for to try some time, depend for the content of the country, to try relation transit between contribution and no contribution regime in the country. Working disempowerment is crucial because some of the experience that are coming before is you have more difficult to try to organize or demand in collective way the informal worker, and this is the problem for to try to access in some time of some right, and also that with not necessary social protection generate, we are thinking out-of-pocket spending for informal working that poor, or maybe some type of catastrophic spending for some specific disease that to low poor system, no? And in this way, when analysis more for the barrier relation for health system, please the next. I think that is more traditional that we analysis in general for the population, but at the same time, we have some aspect that crucial in availability. Sometimes not necessary we have the coverage for accident and professional disease, no, in occupational disease. In relation for accessibility, sometimes the hour of the schedule for the center for the primary health care of the hospital not necessarily is compatible with what happened for worker. And regarding for acceptability, sometimes you have some discrimination for informal worker, but not necessarily is part for the contribution pillar in about for the system and not necessarily recognized of them, no? We are not detailed in the barrier for organization for the system because we have reduced for the time, but I think it's important to try to identify what is the specificity that we have in the process for the organization of the health system in regarding with the informal worker. The next. Well, finally, I will present some for the mapping intervention in preliminary results. With development, we are in the process. We are identify the different intervention about the in the report, in the literature, real literature, and at the same time we have to publish in the different database. But we have a big problem, no? Because we are not a lot of publish, we are not a lot of evaluation. We have only 3 or 4 examples in.
The next one.
We have 2 or 3 examples that we have evaluated in the region. The next, please. And in this way, we represent something in this phase that we stay. We have to collect information in the region and we present some result of them. But I comment this is preliminary. We have a problem that we have to define really strong intervention that really have to provide that useful for to try to extend the health coverage. And in this way, the next, please. The next. Thank you. In this, we present some for the summary. We identified 39 interventions, and this is 33% is the focus in informal worker. And if you have the focus on intervention, there are some of them that the different strategies, some of them is more for the empowerment worker and as expanding health coverage and social protection between of them to try to make synergy. Some specific for expanding health coverage is 13 of them. And we have 44% of intervention expand health coverage in the region, no? We are some type of the intervention, the more frequently is some of the program and policies, very few on legislation. Some of the policies not necessary, we are identifying real implementation about of this. In relation for type of actor, a lot of them is concentrated for the central of government, but some of them is interesting to identify for the local government, for really have sustainability in this way. And in the type of target of population, the more frequently is the own account worker. We have some in the data, some of the information about domestic working in the region. Some of the street vendor, handicraft worker, and recycler worker is very strong in some of them, but it's not the more frequently. And the vulnerable population is sometimes the more general that the people include informal worker, but not necessarily are thinking the focus is informal worker, no? This is some of the mapping that we have available in the region and some of the weakness that we have. Please, the next. The second process that we review is to analyze the cash transfer program, because many times we are thinking the more traditional way that the informal worker, the magnitude of them is more relation for the poor people. Some of these programs more frequently in the country, no, in the region. We have 19 countries to the Conditional Country Transfer Program, please, and you see The unemployment informal workers is only 2 examples specific for Argentina that include a specific intervention about informal worker. The other, the focus is relation for more vulnerable group of the poor people, not necessarily thinking for informal worker. And this is very strong relation that this result that we put beside for the table, that you can see this is the SAM study for the Latin America Commission, and you can see the coverage, the type of social protection in base of the household heading until the more low-level income. And if you identify formal, informal, for the mechanism, the CLAC measurement is the size for the enterprise. And you can see the first column is the contribution protection. It's the mechanism for the people by enrollment, by relation for the relation from the employment that we have to access for the social protection. And if you have for the other side the no contributory protection, this is more for the state to try to promote for the more poor people. In red you have the informal worker in both of them, but in the middle you have the no protection worker. You have the very big group of the informal worker that not necessarily is benefit of the strategy for the cash transfer program, and they sometimes we have the line for the poverty but not necessarily poverty, and sometimes to move in the contract and no contract and formal and informal, and they cannot access for a lot of this program, no? And this is the big weakness that we have, the challenger that we have about of this. And finally, we to present some for the summary. We select the intervention. The first, next please. One of them is the alternative payment condition in order to improve access to health. We put two examples. One of Argentina is the social monotribute. It's interesting because this is some support for the government, the 50% of them, and the other contribution for the population, and they try to put one pooling on all of them. And the second is the more frequently the microinsurance for micro health insurance from Nicaragua. This is some of the experience and was evaluated, but it's not very success. We have in the beginning, we have some incentive for the government, for the people enrolled, but finally, when the incentive for the government go out, the people not continue in this mechanism. This is not very frequently the microinsurance in the region. There are some experience more in Caribbean area, but not necessarily it's the more strong. It depends for what is the story for the welfare state in the region. But this is the one of the mechanisms that are no. But the second group that we like to comment is the Peru and Uruguay is two examples that the process is the regulation for informal job, sustainable through the work organization. That is coming before, no? The strength, when we have a really strong organization to try to move the agenda, they can access for a specific lay or program for to try to health service and all the and coverage of health. But not necessarily they have the capacity to scale up for all the country. It represents for some specific group that have capacity to power or negotiate for the government and also the local government, no? Sometimes it's some example about the street vendor in relation for the municipality or county, no? And the other is the expand health care coverage is initiative more from the health system. One of the examples is Paraguay. Is very strong for the family health unit, is very strong relation for the rural area, and this is the mechanism for to try to extend the coverage for some for the formal worker, relation for rural area, relation for at the same time for the coverage on health. And the other example is from Mexico, is to on the federal level, they try to formalize some for the health sector worker. And when we try to formalize the health sector worker, the argument additional about this is to try to give the best quality service about the population, no? And this is the mechanism, the initiative inside for the health system promote some linking for informal workers, but not necessarily directly with them, no? Finally, the next, please. Yeah. Finally, put all, please. Because you. No. Okay. And finally, I think the challenge for universal health coverage for informal workers, I would like to try to keep in mind or remark that for one side, we have the barriers associated with employment conditions, and in this way, we need to extend the labor right informal economy, no? On the other side, when we need to put the barrier for organization of the health system, and in this way, we need to healthcare, not condition employment relation. This is one of the strong discussion, but we need universal health coverage associated for the citizen, no? When we have to the health coverage only association for the contribution mechanism or relation for employment, we have the problem for to really access. And sometimes maybe we have to more group access in the one perspective, but we have a lot of inequality relation of this. Thank you.
Thank you very much, Orielle. Are there any questions for or comments for Orielle? Peter.
So thank you, Orielle. I just have one question. I hope you can hear me. Can you say,
Yes.
Can you explain a little bit more what definitions for coverage you used in carrying out this analysis? How did you think about the meaning of the word coverage?
Mm-hmm.
Go ahead, Orielle. Feel free to answer now.
Yeah. Well, when we talk about the coverage, well, I commented before when we analysis some of the survey, in some of them use the coverage, for example, in some of the data or the thirds of them, you use very frequently coverage is the same for enrollment, no? In some of the data on the survey, no? But also we try to include not only enrollment, we try to include unmet health needs to try to identify in some of the survey. And we try to survey coverage in a specific need for the people expressed in the survey, and we try to identify what happened for access of them. We try to identify different indicators in the survey to try to follow up the health service coverage. And this is the process that we are doing for the survey available. And this is the reason that I comment when to analyze some of the survey in the region, and also include not only health, some indicator for the proxy for informal worker, because this is a problem in some of the data. Sometimes the household survey or sometimes the social protection survey not necessarily include strong for the health, or the question is very reduced. And sometimes when you analyze the health service, you include some strong for health, but not necessarily strong for informal worker. And when to try to identify the proxy for informal, and at the same time identify when the people measurement something for health service coverage, at the same time we identify unhealth needs, and then sometimes some enrollment. This is the three indicators that we use to try to construct and build the health system coverage on service, no? I don't know if this is clear.
No, that's very helpful. I just would add just one comment. I think it would be very interesting to, and maybe you're doing this already, to bring out that analysis, because I think it will be very helpful for people to see that the kinds of indicators that are measured for coverage are quite different for different kinds of sources of data, and to unpack a little bit which kinds of coverage are associated with which levels of healthcare access or financial protection and so on. I think there's a lot of confusion about this right now and a potential to clarify.
Thanks. We have only a few minutes left in the session, and I'd like to go back to the question and then invite other questions to round out the session. You can turn your 10 cards up.